Good morning. My name is Efrem Panchana, and I am going to talk about periodontal disease complications. Definition: periodontal gum disease is an infection of the tissues that hold your teeth in place. It is typically caused by poor brushing and flossing habits that allow plaque, a sticky film of bacteria, to build up on the teeth and harden. In advanced stages, periodontal disease can lead to sore, bleeding gums, painful chewing problems, and even tooth loss. Applications in odontology. In odontology, the periodontal disease complications is treated with periodontal therapy and with a deep cleaning. Now I'm going to talk about the pros and cons. The pros are a beautiful smile, fresh breath, identification of other health problems, tartar removal, and there's no cons. Issue applied in Ecuador. The periodontal disease complications in Ecuador is applied by the periodontists, who are the ones that are specialized on this topic and can make a treatment of this problem. In conclusion, periodontists will have the authority to heal and eliminate the periodontal disease complications with different types of therapy and will make also preventive dental care. Now I'm going to show you some videos of examples.
Periodontal disease begins in the gingival sulcus, a cuff of soft tissue around the necks of the teeth, where they emerge through the gums. Healthy gingiva are pink in color, and the sulcus depth ranges from 0 to 3 millimeters, measured from the tip of the gingival margin to the base of the sulcus. The attachment fibers connecting the gums to the teeth and the teeth to the bone are intact. The gums are resilient and neither bleed nor hurt when being probed. During meals, food debris accumulates in the sulcus. When mixed with mouth bacteria and proteins from saliva, plaque and less obvious biofilm are formed. Both are harmful to teeth and periodontal structures. Left in place on the teeth, bacterial plaque and biofilm begin to mineralize, forming hardened deposits called calculus, which can only be removed with dental instruments. In response to the increased bacteria adjacent to the soft gingiva, the body sends immune cells and healing cells to the area by way of the circulation. The increased blood flow to the gingiva produces red, enlarged, and tender gum tissues, a reversible condition known as gingivitis, in which the periodontal attachment fibers remain intact. Continuous exposure to acids and enzymes from plaque bacteria and the body's immune response to them eventually causes the periodontal attachment to be lost, an irreversible condition known as periodontitis. The sulcus depth increases to the point where the patient can no longer effectively remove plaque, leading to the destruction of tooth-supporting bone. Smoking impairs blood flow and can significantly interfere with a patient's ability to fight the bacterial infection. Other factors may be involved. Generalized periodontitis affects all of the teeth. They may loosen, appear unnaturally long and unattractive, and may ultimately be lost. When multiple back teeth are lost, the front teeth may be unable to support closing forces of the jaw muscles. They begin to tip and move. The cheeks begin to collapse inward where the back teeth are missing, and the lack of proper support for the jaw joints may cause them to ache, pop, and click. Periodontal bacteria can enter the body's circulatory system through leaky blood vessels. Once inside, the bacteria can lead to blood clots and inflamed vessels, which constrict in diameter, leading to strokes, heart disease, heart attacks, and poor circulation in the extremities.
Secondary prevention of periodontitis aims at preventing disease recurrence in patients previously treated for periodontitis. Disease recurrence relates to disease progression in a patient previously successfully treated for periodontitis. Disease progression is defined as the continuation of significant attachment and/or bone loss, clinically detectable by probing and/or radiographic assessment, eventually leading to tooth loss. The optimal endpoints of active periodontal therapy in the management of periodontitis are the reduction of signs of inflammation, as defined by full mouth breathing on probing scores, the elimination of deep pockets, and the absence of signs of active infection as defined by the presence of suppuration. Whenever possible, these endpoints should be reached before the patient starts supportive periodontal therapy, SPT, in order to optimize secondary prevention of periodontitis. Professional mechanical plaque removal, in the context of secondary prevention of periodontitis, is the routine professional mechanical removal of supragingival plaque and calculus with subgingival debridement to the depth of the sulcus pocket. This is part of supportive periodontal therapy, SPT, which should also include the evaluation of oral hygiene performance, motivation, and re-instruction in oral hygiene practices, and when appropriate, smoking cessation, control of comorbidities, and promotion of healthy lifestyles. As part of this intervention, a periodontal examination must be conducted with the aim of early detection of deepening pockets, which should undergo active periodontal therapy. After effective active periodontal therapy, patients should follow a specific supportive periodontal therapy regime. based on 2 to 4 sessions per year. However, the frequency of SPT sessions should be tailored to a patient's risk. Since the level of compliance is unpredictable in the long term, specific measures should be adopted or implemented to improve the level of patient adherence to the maintenance regime in order to enhance the effectiveness of the intervention. Patient motivation and instruction in oral hygiene practices should be combined with PMPR.